one of the medical professionals that I'm really good friends with, she's a retired doctor. She understood the mental stress that my body was, in my mind, was about to undergo. Although I didn't have to go through chemo, I had to go mentally go through all the things that a person with breast cancer or ovarian cancer had to go through. And so she matched me with a mindfulness coach. And so this mindfulness coach helped me put the situation in perspective. She was a woman as well. And like I said, I didn't want to do reconstruction. The doctors were so confused, especially the plastic surgeon. And I don't know if it was because they wanted more commission if you do reconstruction, but I didn't want to do reconstruction. I felt that I was blessed to know that I had the gene and that I had a 99.9% of never getting cancer if I underwent the double mastectomy. And so, what if that 1% chance did happen? I didn't want to have implants in it. I didn't want the doctors to come back and say that, there's a recall on the implants. I wanted to be okay with how I look without breasts. And so, my mindfulness coach helped me. She was there the very first time that I looked at my chest, and I was about to cry because I had one request, and that it was that my breasts did not look like my grandmother's, that it did not look sunken in. And immediately after my surgery, I wasn't bandaged, but I wanted to get up. I knew in my mind before I underwent surgery that right after surgery, I wanted to get up and use the restroom on my own. I didn't want to be hooked up to a catheter. And so I'm probably 30 minutes to an hour out of surgery, and I asked to be taken to the bathroom. And so when you walk in the bathroom, there's a mirror there, and my gown is open, and I saw my chest, and my chest was sunken in. And so I looked away. It took me several weeks. We had to cover the mirrors in the house. I had a lady with home health come over every day, change my drains, and to give me a wash up. But I wouldn't look at my chest because I know what I saw when I looked in the mirror. And my doctors came in the room, and I said, "Is my chest sunken in, my plastic surgery?" He was like, "No, no, no. You're minutes out of surgery. So of course it's not gonna look the way it's going to look. And so give it time, give it time." And that's what everyone. So I looked at my husband, I looked at my friends in the room. I said, "Is my chest sunken in?" And they're like, "No, you're fresh off the surgery table. Relax, recover." Well, I needed my mindfulness coach to look with me. My husband couldn't do it because he's a man and he wouldn't have the same empathy that a woman would. And so when I finally got the courage to look at it, my mindfulness coach was there with me, and my chest was sunken in. And I knew it was, but I had to see it. And tears started to well in my eye. And she looked at me and she said, "But you don't have cancer." And it was at that moment that it's okay if your chest is sunken in. Who would see it? Who's going to see it? Um, and so she helped me to mentally process how I felt and how I looked. And so if you're not okay, once you make these decisions and you find yourself in places or situations where it's hard for you to mentally understand, reach out to a medical professional that can help you with your mental, because that's half the battle. It doesn't stop after you make the decision. It doesn't stop after the surgery. You think you're going to be pain free and brave and bold, but that's just the beginning of the journey. And so I wanted to share that to let women and men know, like, continue to get the resources that you need to heal mentally and physically.